everybody. Welcome to the last segment of this episode of Frank About Health, where I'm being frank about integrative medicine, especially now in this segment. It's very important. For the last 45 minutes, we've had a chance to speak with Ms. Janet Neal, who's really, in my mind, explored or brought about new issues and new challenges that people with various developmental disorders have to face, but at the same time can actually deal with. And Janet, I wanted to share with you some information about me with epilepsy. As I said earlier, it is genetic, and then as a result of one seizure that I had in 2003, I repeatedly banged my head on the floor and developed a lesion, which gave me partial epilepsy. Only this past summer, I was diagnosed with nocturnal seizures. I had 3 of them while sleeping. I didn't even know they existed. I do know that's under control right now, thankfully.
Good.
But what I did understand for me is that what controlled that was acupuncture.
Yeah.
And at the same time, what continues to control my epilepsy are very interesting and least toxic drugs. One in particular, which I've expressed on the show, called Lamictal, which also has psychotropic properties, helps with increasing energy and reducing depression. Mm-hmm. But what I've also discovered, which I'm sure a lot of people have, is that these branded drugs are no longer affordable. And speaking about affordable, the Affordable Care Act does not seem to be providing any support in the area of drugs, especially for epilepsy, and I'm sure for other kind of developmental disorders. I've had the opportunity to have on this show 2 people who are the owners and I believe even the developers of Mark's Marine Pharmacy based out of Vancouver, Canada. At this point, for practically the same price as 1 bottle of my medication, I can get a 3.5, 4-month supply of the drug for the same price and without insurance. So I am a proponent of getting your medication outside of the U.S. Mm-hmm. But at the same time, I am a proponent of the way that they do their treatment of patients. They actually go through a holistic approach. Mm-hmm. When they speak to a new patient, they first find out what their disorder is, why they need the medication, how they think they've developed it, what their doctors have said, but then they also contribute what they think can be used to treat it. One of the things they talk about are herbal medicines. They talk about, of course, acupuncture. They talk about even other things that they are creating in their own laboratories that they've found to be productive for their Canadian residents. And I have been really talking to them about this show and the value we can provide to them, especially since at this current time, 98% of their business is from the United States. So with all that information about my background and what I've been trying to do, it's like me being an advocate for everyone out there to continue to do the research, to continue to get the best treatment. But with what you've explained over the last 45 minutes, I definitely would like to know your thoughts on what I've been doing and how that probably fits what you've been doing and how we can go forward from there.
Whew, big old question.
Yeah, I know, right? 15 minutes, but 15 hours worth of conversation.
Yeah, well, it's going to take me about another week and a half to answer that question. But I think that you have to be your own advocate. I think that, which is something I said earlier about if something is wrong, don't let somebody talk you out of it.
Right.
I've had loss of medication because I've been stuck with Medi-Cal, and Medi-Cal doesn't really care what your diagnosis is. Some stuff they'll pay for and some stuff they won't. They also will let you have stuff for a little while and then take it away, which is part of the reason why I was happy to be able to do the acupuncture, because it's gotten me away from that. Mm-hmm. And then one of the things that I discovered is the side effects of all of this stuff that they were giving me.
Yes.
That it can have an impact on personality. It can impact. It can flatten your affect. It can flatten your reaction to things, where things will happen and you don't know that they happen because you were experiencing this side effect of the drugs. As I know, even with the HIV drugs, which they won't let me stop taking it because they're afraid something will happen.
Right.
But I've modified my doses with it, but there's side effects with that are just absolutely terrible. which makes a lot of people not want to take it, but you need to take it. And I think it's that way with a lot of the different medications. I've heard patients talk about the medications that they take for epilepsy. And I did an internship at a neuropsychiatric hospital, and that was one of the chief complaints of the patients is the side effects from the medication.
Yes.
So I feel that the integrated medicine is probably a better way to go. It isn't as hard on the patient because sometimes the, quote, cure or the, quote, treatment is worse than the disorder.
No, yeah, I mean, and even like what we're saying is once you have all these side effects, then you're taking even more treatments for those side effects.
Yep.
I
One
guess...
drug on top of another drug on top of another drug. I was diagnosed with something called xerostomia, which is dry mouth. And come to find out, it was coming from all of these antihistamines and decongestants that I was taking, which I don't take anymore. And so it improved the dry mouth syndrome that I had. So, I wish we had figured this out sooner, because with the dry mouth syndrome becomes a lot of dental problems.
Right.
So I've got like 7 dental implants.
Oh my God. I mean, how do you pay for all of this, if you don't mind my asking?
I have a special needs trust that my father set up for me.
Interesting. I said something on my last show, which actually talked about cancer, that you have to set up an investment fund of sorts. I'm not talking about health savings accounts, but I'm talking about...
There's another thing that, like, I have splints on my hand, but they're sterling silver. They look like a piece of jewelry, but they're made specifically for Ehlers-Danlos syndrome to keep my fingers from what they call swanning, which is when they bend back too far. Wow. And Medi-Cal paid for those. There's a way to get Medi-Cal here in California to pay for stuff. Because of your disability, which I want to briefly mention the Americans with Disabilities Act, because that is the road into getting what you need to have. You ask when you need something and they say no, and you respectfully request a reasonable accommodation under the Americans with Disabilities Act. Right. And that's a yes or no question, and they will go, what are you talking about? No, we can't do that. And they say, okay, so then you're refusing, and they'll say yes or no, and you say, okay, well then that's failure to provide a reasonable accommodation under the Americans with Disabilities Act, and you go straight to the Department of Justice and make your complaint.
Now, on that note, what do you think is going to happen depending on who our new president is with these acts? Or maybe that's not an appropriate conversation right now.
It is. It is. I'm very worried with one of the candidates, with the dismissiveness and the marginalizing of groups of people. I'm very concerned because I keep hearing some of the programs that benefit people with disabilities or people that are below the poverty level are considered entitlement programs. And it bothers me that these individuals that are saying this, received help. They received food stamps, they received Medi-Cal and things like that. And now that they've become successful and have a high income, they're looking down on the rest of us that are still below the poverty level. And I'm very concerned about how that's going to interact with the homeless population. We have too many people with disabilities that are on the street. And most of them have mental health issues. Yes.
What do you think that's going to do for integrative medicine with all these holistic techniques and acupuncture and everything we've been talking about?
I don't think that it's going to, the federal level is going to catch up. I think here in California, we will probably catch up before anybody else. I'm hoping that at some point in the very near future, our governor will sign something that gives more credence and credibility to acupuncturists and the alternative medicine. It's coming. It's just slow. Right. The insurance companies don't want to pay for it. It gets people well, and that's not what they're in the business of. They're in the business of people being sick so that they can charge you. over and over and over again for treatment that, as I just said, you end up getting too much medication and all these side effects. We have people that have become dependent on pain medication and things like that. I would like to see something happen within the alternative medicine community to lessen that particular burden on society. I also think, going back to the Down syndrome, excuse me, and the autism, I also feel that acupuncture has a direct impact on those conditions also, to allow you to manage your condition better.
Because it is affecting your body, which is in itself being, the genetics are basically continuing to manifest whatever symptoms are with those.
Well, I have a theory that because of something I did called Neuromuscular Reeducation, where you basically reboot your nervous system, so that when you have a neurological issue, it can soften. It also helps to, I'm going to use the term, massage a gene, because genes can change.
Amazing.
Just like they mutated to cause the disability, with constant reinforcement, like I'm saying, through the neuromuscular reeducation, constantly sending a new, clear message.
Right.
The body reboots, and that makes that old message of the illness in the past and not a new memory. You make new memories for your muscles, because muscles have memory.
Right.
Nerves have memory. It all has. So you have to get rid of that old memory of the illness.
Yes.
I hope this is not too complicated.
No, but actually,
it's like reprogramming it. It's like wiping your computer clean and going and starting all over again. It's rebooting your body. When I've done the neuromuscular reeducation, right after the treatment, the therapist would have me write, which I couldn't understand why she would have me do this. But once I started doing that, I could see why, because I noticed a difference in my handwriting. I could read it.
Yes.
I noticed my thought clarity. It's so what that was doing was increasing the serotonin, which is a neurotransmitter.
Janet, I don't mean to interrupt you. I've just been given the signal that it's time to end. I definitely am going to give you a call and talk further. Thank you so much.
I told you we could do this forever.
I know. Janet, you've been the best. I appreciate this. Ladies and gentlemen, thank you for being on this episode of Frank About Health. I will be in touch pretty soon. Janet Neal, everybody. You can check her out on Google. And ladies and gentlemen, this is a wrap-up. Thank you again.
Thank you.
All right, take care.
You're listening to the Talking Alternative Network.